coronary-artery occlusion from Kawasaki disease. Definition: Kawasaki disease is an occurring systemic vascular predominantly affecting medium caliber arteries, including coronary arteries. Most causes occur in children under 5 years of age, while and seem predominance in males
of the immune system to stick to the endothelium and leave through the blood vessel wall. Inflammation in the vessel wall is caused by immune cells gathering in the wall and liberating chemical signals that recruit more cells and further damage the vessel wall. Intravenous gamma globulin, or IVIG, interacts with these cells to quiet down the immune response, although the exact mechanism of how this is achieved are poorly understood. When inflammation occurs,
application in nursing intervention in patients with this disease will depend on the patient condition and the evolution of the disease. The nurse will be in charge of identifying sick and symptoms
and high cholesterol, and the sign is chest pain. This just shows a picture of the buildup of plaque in the vessel walls. So I'm going to give you a timeline to give you an explanation on how this coronary artery disease process works. So this is our vessel, and say we have high blood pressure. It's going to damage the vessel walls by damaging the tissue of the walls. So during the second phase, inflammation is going to actually occur. So we've got damage on the walls already, right? So then it's going to start to thicken, scar tissue will form, and it's going to create a much narrower pathway for our blood to get through and build up plaque. So with diabetes actually causes inflammation and the slowing of the blood through the vessels, okay? Hyperlipidemia, remember the buildup of fat, which is the buildup of plaque in the vessels. And then those that have a family history of coronary artery disease are likely to get it. Okay, so the damage, the buildup of plaque, and the blockage in the coronary artery supplying the heart is going to cause serious complications in the patient. So if blood flow is cut off from the heart muscle is going to start to die, which is what a heart attack is, right? So acute coronary syndrome.
Pros and cons: the frequency of coronary artery abnormalities in Kawasaki disease and the associated mortality of rising dramatically as result of travelers in immunoglobulin. There are patients entered with intravenous reversible coronary artery dilatation, no true aneurysms. Applied in Ecuador. In Ecuador, according to the Minister of Public Health, Kawasaki disease is considered a rare disease with a prevalence of less than 1 per 10,000.
Kawasaki disease is a vasculitic disease in which medium-sized arteries throughout the body become inflamed. It typically affects young children from 1 to 5 years old, but can sometimes affect teenagers and even adults. It's usually a self-limited condition.
Conclusion. To conclude, mortality due to Kawasaki disease in rise among children treated with intravenous immunoglobulin. Long-term morbidity is primarily related to the dearth of coronary.
More about integrating our multimodality imaging choices and perfusion tools over time. The diagnosis for most children more than a year of age for Kawasaki's is based on clinical criteria, so you really don't need to do an echocardiogram before starting IVIG if you meet the clinical criteria that Dr. Neuberger went over. However, echo is a vital tool in the diagnosis for those who have incomplete features, as from this very familiar. Stress test is a whole nother category. One thing I would say, just remember, is that plain stress test, just climbing on and looking at the EKG, is not enough, not sensitive enough in our patients to assess for at-risk myocardium, but I do find it sometimes helpful in making sure that they're not going to be having arrhythmias before going out and playing.